another word other than alternative, and that is functional.
Yes.
And I really like that. So let's talk about alternatives.
Yeah, well, you know, one of the best examples is the use of glucosamine sulfate in the treatment of osteoarthritis, which is the most common form of arthritis. Most people are familiar with that, but I like that example because it really contrasts the drug approach. The drug approach is usually using aspirin, ibuprofen, or these newer drugs to suppress the pain and inflammation. But these drugs work by blocking the production of compounds that are necessary in the manufacture of joint cartilage. So if you take these drugs long enough, you'll actually end up with greater joint destruction than if you would have taken a placebo. Now, in contrast, the natural approach is to give the body the tools it needs to be healthy. And what's remarkable about human cartilage is that these cells are designed to last a lifetime, and they're one of the few cells in the body that you can put in a test tube, and if you feed it the right nutrients, it can regain its youth. If that can happen in a test tube, theoretically it can happen in your body, and that's why studies with glucosamine sulfate and other compounds that promote healthy cartilage are showing such promise in the treatment of osteoarthritis. I also in the book highlight the natural approach to digestive disturbances. I mean, it's amazing the way that we're treating digestive disturbances, whether it's non-ulcer dyspepsia or gastroesophageal reflux disease or irritable bowel syndrome. The gastroenterologist or medical doctor typically gives drugs that block the body's ability to digest food. The natural approach is if you have a digestive problem, you want to treat it by giving the body the tools it needs to better digest the food. And that's what I point out in the book.
And we are actually going to talk more about alternatives later on in the program, so don't go anywhere. In your book, you talk about the tomato effect. I love this story. What exactly is that?
Well, the tomato effect points out that in the late 1800s, it was a common misconception that tomatoes were poisonous, and it wasn't until a gentleman in 1820 on the steps of the courthouse in Salem, Indiana, actually ate a tomato that really many people believed that the tomatoes were safe. And even though they were consumed as a staple in Europe, it was a common misconception that tomatoes were poisonous in America. There's a common misconception that natural products and dietary approaches are not effective. The truth of the matter is, I've been collecting research over the last 30 years that shows convincingly that for most common health conditions, there's a stronger scientific rationale on the use of diet, attitude, lifestyle, and proper nutritional supplementation in the treatment of these common illnesses than there is for many of the drugs that are in vogue. And we've got to get people on to these natural approaches for their lifelong health, as well as to reduce healthcare costs and to really make a difference in not only their lives, but as a nation, our lives.
The thing that I found fascinating is that you say that 70% of patients with chronic daily headaches is really drug-induced.
Absolutely. It's just amazing. Yeah, 70 people, and you can't really say it any better than that. 70 people with chronic daily headaches suffer from drug-induced headaches, and if you simply help them wean themselves off the drugs, their headaches go away. Now think about that. You know, so they've got this chronic problem, and so what they generally do is they take a drug for it, and drugs typically have some side effects, and so they end up taking many times drugs to suppress the side effects that the first drug causes, and it's just a snowball, and that's why so many people are on so many different drugs, because they're taking drugs to deal with some of the side effects they're having from the primary drug.
When you talk about common digestive disturbances, what's the difference between the drug approach versus the functional approach?
Most often when people have any sort of digestive complaint, it seems like they're getting these very powerful antacid drugs, and these drugs, they cause a lot of side effects because they're blocking a vital bodily function, which is the secretion of acid in response to food. That's how our digestive system really gets rolling. Only about 10% of people that are suffering from ulcers or gastroesophageal reflux disease or some of these other digestive complaints have excess acid. So 90% of people are taking a drug that more than likely is not really indicated and may cause significant side effects. In contrast, the natural approach is to try and identify what the cause is. For example, gastroesophageal reflux is a very common condition in America. It's common because of certain foods and the fact that we overeat, and if you address that issue by eliminating the common foods that can cause the acid reflux, in many cases you can totally eliminate it. Now, some people may not like to give up their coffee with their meal, or you know, maybe their chocolate, or maybe they have a food allergy to milk or whatever. But if they would do that, then they would find themselves getting the relief that they need versus taking a drug that can cause significant problems.
Let's talk about specific examples of alternative health care. And let's start off with heart attack and stroke.
Yeah, that's a good one. I mean, combined, by far, those are our biggest killers. And, you know, there's so much misinformation out there on how to prevent heart disease and strokes. Everyone thinks, oh boy, if I take this little pill to lower my cholesterol levels, that's going to provide the answer. I believe that these statin drugs, these cholesterol-lowering drugs, this widespread prescribing of them will go down as the greatest medical hoax in the history of the world. Why? In my book, I describe a term called numbers needed to treat. And basically what that term implies is, how many people do you have to treat to see the benefit? You have to treat 50 people for an average of 10 years to prevent one heart attack when you use these statin drugs. So what people don't realize is that over 50% of people that have a heart attack have normal to low cholesterol levels. There's more to the story. You have major risk factors, not just high cholesterol, but high blood pressure, diabetes, smoking, lack of physical exercise, and obesity. And you have secondary risk factors, which in many cases are more important than the primary risk factors. Things like low levels of antioxidants, low levels of omega-3 fatty acids, not enough magnesium and potassium. In some cases, that's the underlying cause of a heart attack or a stroke, not high cholesterol levels. We've all been sold a bill of goods with these statin drugs. The only people that these drugs have really benefited are the drug companies. 80% of people that are being prescribed these statin drugs are taking them for no good reason.
Well, you're talking about cholesterol. Why do we focus on it so much?
Because the drug companies have an answer. They have a drug that can lower cholesterol. And it defies conventional wisdom. There's no question, if you look in population studies, that high cholesterol levels are associated with an increased risk of having a heart attack or stroke. So the idea is that if you lower cholesterol levels with the drug, that people should live longer. But the proof doesn't show that. The studies show that these cholesterol-lowering drugs do not increase life expectancy. They do have their place. They're very useful in people who've already had a heart attack or people with significant risk. But for the majority of people, 80% of the people that are being prescribed these drugs, there's absolutely no benefit that these drugs are providing.
And that's because it's the #1 moneymaker?
It is a huge moneymaker for the drug companies. They are making a fortune on this myth. It's a house of cards. It's a house of cards. Eventually, the physicians are going to read the studies that are published in the prestigious journals that are based upon good research instead of the drug-funded research, and they're going to see that, boy, we've been sold a bill of goods. This isn't really providing any benefits to my patient. It's potentially causing serious harm, and the only people it's really benefiting are the drug companies.
Well,